Hello, everyone. It is a little bit past 12. This is pretty loud. Is this loud for everyone?
No.
Oh, okay. It's loud for me. Cool. We are a little bit past 12:30, which means it is time for our panel. This is a panel made up of individuals who are working in different spaces and different intersections of ID access, such as housing, criminal justice, rural communities. I believe yes. So and then of course spaces where substance use disorder. And so this panel is going to be led by Kat Calvin. Um, Honestly, I think at this point, I don't think I need to do another introduction. Kat Calvin has introduced herself into the room and made herself known. And of course, we have Marissa Goldfaden. And Marissa has served as the general counsel and director of communications at Project ID and Spread the Vote. She is also the co-founder of Project ID Action Fund. She is passionate and knowledgeable about the access of vital documents and IDs and strongly believes in the power of public policy to improve people's lives. And a couple of things, I know that I did introductions before, but a couple of things I do want to flag before we get into the panel. We're halfway through the day. Make sure that you're filling out those bingo cards. We've got a handful of prizes. And then secondly is I passed around some of my cards on the table, so you'll see that so we can connect afterwards. And with that being said, I'll go ahead and introduce our panelists. Not too much because they're going to introduce ourselves, but just the names and what they're working with. Originally, we were going to be joined by Danny Lacio as well, but unfortunately, he's sick. So right now we have our four panelists. The first I would like to introduce is Adam B. I'm sorry, buddy. I don't want to butcher your last name. So Adam is the director of the One Door program at Community Partnership of the Ozark Affordable Housing and Homelessness Prevention. We also have Sandra, and thank you. Is it Sandra or Sandra? Sandra. We have Sandra who kindly stepped in last minute to join our panel, so thank you. And Sandra is the director of the T, a holistic harm reduction program dedicated to harm reduction and supporting individuals affected by substance use disorder. And then, of course, we have Jolene Patterson, who came all the way in from Joplin, I believe, right?
Gerald.
Oh, yeah. So Jolene is the executive director of the Vital ID program of East Central Missouri. So, of course, she very much focuses on rural communities. And then we have Stephanie Moore, who is the director of ranching programs at Criminal Justice Ministry. With all that being said, I will pass the mic to our moderators.
Thanks so much, Rita. Thanks for the introduction, and thanks for having us. I'm very excited to be here. So this section is going to dive into the on-the-ground work that a few of the coalition members are doing to ensure that people can access identification across the state of Missouri. So we're going to ask some prepared questions, and then we'll open it up to all of you to ask any questions that you may have for the panelists. So to get started, we just want to ask each of the panelists to share who you are, what your organization does, and the demographics that you work with.
Sorry, which way? Okay.
You got the mic.
Hey everybody, yeah, my name is Adam Bodendak. I did not expect Sheree to have to pronounce it. It's a tough one. That last name, lots of superfluous vowels. Like even within our family, not everyone agrees. So there's a whole range, and you get to pick how you want to pronounce it. Yeah, I am Senior Director of Homeless Services for Community Partnership of the Ozarks. We serve Springfield, Greene, Christian, and Webster counties, so down in the southwest part of the state. I work within our Affordable Housing and Homeless Prevention Division, and so that includes a few different things. Primarily, we operate a one-stop shop where we have brought together 20 different partners, the O'Reilly Center for Hope, where we have our coordinated entry system. If anybody here works in the COC world, they're familiar with some of these terms and acronyms that I'm going to spit out. But the continuum of care, the COC for our area, the coordinated entry system, the access point for anybody trying to locate services, whether it be emergency shelter, transitional housing, or permanent supportive housing services, flows through the One Door program at the O'Reilly Center for Hope. We do a lot of ID assistance as part of that because, as has been highlighted multiple times today, you need IDs for everything, whether that is employment, shelter, housing, benefits. So we do a lot of work trying to help individuals obtain their IDs, and I'm looking forward to talking to everybody.
Good morning. Jolene Patterson. I'm with the Vital ID program of East Central Missouri. We have a pretty wide demographic that we cover. We cover now 15 counties that surround St. Louis and St. Louis County and East Central Missouri. We have more extensive programs in some areas than others. Our basic model is that we do provide services to individuals, but because we're rural and the city models of being able to run clinics don't work well because we have no transportation in rural areas, we basically work on a train the trainer program. So the idea is that people who are doing first contact with an individual, whether they're in the correction system or domestic abuse, health, mental health, or if they're just homeless, we want their first contact to be where they get their initial ID. And we're finding that about 85 to 90% of the cases in our areas, in rural areas anyway, are people who need Missouri birth certificates and not out-of-state ones. So they're not particularly complicated. We've involved churches and a variety of other organizations to do this. We train the people, we provide forms and materials in areas, and then we run a hotline. And our hotline is a referral service out. So individuals can call in from any of the counties in our area. And I usually answer the phone while I'm on the tractor mowing hay or feeding the chickens or something like that. And then I tell them where they can get services in their area. And then we support those agencies with reimbursement funding or training or any other kind of materials they need.
Hello everyone, my name is Sandra Mayan. My pronouns she and her. We are a holistic harm reduction center. We actually right now going through organizational restructuring. So we are under the Powerful STL, where we provide services for people who use substances, in particular opiates, but we also provide services for people with gunshot wounds. Our founder is a surgeon, and if he is able to actually take the bullet out carefully and safely, he is able to do that in our offices. We also provide people with acupuncture services, chiropractor, physical therapy, and our focus is mainly holistic care. We connect people to treatment services. We also have trainings. We educate people on how to recognize and respond to an overdose, and we supply people with Narcan. Everything we do in-house, we also do outside outreach locations. Right now, we go to, I believe, 9 locations in the city and 6 in the county. We go 5 days a week. We take Narcan, we take wound care kits, we take hygiene kits, and our model is education and empowering people. We celebrate not necessarily people completely stop using, but we celebrate people not using chaotically. So if people, instead of using 7 times a day, if you use 5 times a day, we celebrate that, and this will be our point, and we move forward. We have created some things in-house that we provide to participants, supplements that helps with withdrawal symptoms, also helps with the urge to use, and we give it to them carefully. We evaluate our patients, and yeah, we just believe in harm reduction. And if it's a sandwich, we give people food. That's harm reduction. We give people can take showers and do laundry. That's a form of harm reduction. So we just educate the community and provide a safe space for our people.
My name is Stephanie Moore, and I am the Director of Criminal Justice Ministry, Director of Programs, Reentry Programs at Criminal Justice Ministry. My pronouns are she, her. We provide wraparound services, more importantly, housing services for people who are coming out home from prison from long-term sentences, so from 10 years or more. We also serve the homeless population with our first services programs. So under me, we have First Services, so they get referred, individuals who have been just as involved get referred to us for backpacks, ID, birth certificates. We also do out-of-state birth certificates, and most of the time they need to be notarized, so we can also do that as well. We provide transportation if they have to go to court outside of St. Louis area, round trip, as well as if they are leaving a federal halfway house and are trying to go home because they've completed their sentence, go home out of state. We will provide transportation for them to get home so that they don't come back to Missouri. So our housing program, we have 5 housing programs under me, 3 under that house vets, and the other 2 we house women and men. Our programs, they are in our program anywhere from 6 months to 2 years, depending on the housing program. And we also serve sex offenders. So one of the few agencies within the state that will house sex offenders in our housing program. So they go into their own apartments. We also provide wraparound services, so case management. We have behavioral health specialists. We have nurse practitioners on staff. They have to go to treatments, and we help them with any kind of fees that they need.
All right, thanks all. Jolene, you're living out my tractor dreams, and I'm so jealous. I'm trying to figure out if I can get a riding mower for my very small backyard, and I think if it makes tight turns, I can make it happen.
Called Zero Turns.
0 turns. I need like the Ferrari that just like. I love that everyone's from a really different organization, which I think probably sees the need for IDs present in very different ways. So, can you all talk about how ID access presents for your clients in your organization, what the barriers look like for the clients that you work with, and if your group does direct support, what does that work actually look like for you?
Yeah, so we are working with unhoused individuals experiencing homelessness. What we see as the biggest barriers, one, cost, right? We've talked about cost, so that is a large. We can't hear. Sorry, I'm normally like too loud, and so I'm trying to be conscious of that.
Testing. Are either of these louder?
Here, this one is extremely loud.
This is a little loud.
On the wall. Try it again.
All right, how's that? Is that better? Oh, okay. See, it wasn't me. It was this. So sorry about that. Yeah, we work with individuals experiencing homelessness and unhoused individuals, and so the barriers we see: one, cost for getting ID. Even more so than that, it's the supporting documents that you need to get an ID. And I think, Kat, you mentioned it earlier. You need a birth certificate to get an ID. You need an ID to get a birth certificate. You need both of these to get it's the circle, right? So a lot of times people come to us and they come to the One Door program for assistance in both of these realms. So one of the things we're able to do, we are a mailing address at our center. We're a mailing address for those who don't have an address. And so we can fill out the form. We can write a letter verifying somebody's homeless status and listing us as their mailing address. And so that will stand in for that requirement. And then we use something called HMIS. It's the Homeless Management Information System. It is a HUD mandated database, essentially, which is where they collect demographic information for those experiencing homelessness, all sorts of other things. And we are able to generate a picture ID from that system, and that will stand in as a form of ID that is accepted at our local DMV. I will be completely honest. The reason this works is because when I started doing this about 9 years ago, I was told that this was a huge gap and that people were having difficulty getting IDs. So I baked some cookies. I baked some cookies and I bought some candy and I put together this lovely little plate and I went up to one of our local DMVs and I introduced myself and I said, "Can we please be friends?" And they said, "Yes, provided you keep bringing us stuff." So every year they get a homemade cheesecake, they get chocolate chip cookies. In all seriousness, and they have become some of our fiercest advocates in helping us provide access to for the folks we serve, which is fantastic. But yeah, so we provide the documentation and we provide the funding. Typically, we are meeting folks up at this DMV once a week, or we have a shuttle, we are arranging rides and we're getting up there once a week. And we probably help approximately 10 to 15 individuals a week that we pay for the IDs. And then on top of that, we're able to provide documentation for anybody else that does have the funding and they can purchase it on their own, but they just need those documents. And yeah, did I hit all the parts of the, okay, all right, thank you.
I think in rural communities, we see a lot of the same barriers to service that other people do. Availability of government offices is one of the bigger areas that's in rural communities, though. We don't have a social security office in every county. And so the nearest social security office, for example, if you happen to be in Troy in Lincoln County, is to go to Hannibal, which is 62 miles away, or to come into St. Peters, which is 30 miles away. Big barriers to getting access to services. We have a lot of health departments, but the health department hours, as everybody experiences in the cities, are limited. They run in our areas from usually 8 to 4:30, and they're not open on the weekends. And so better hours would be more of a plus for us. There's also a lack of consistency of knowledge and application of that knowledge within the government agencies. So what they do and how they do it, we have a list of where to go based on how cooperative the offices are in our area, and we frequently buy them goodies on a regular basis. We swear by that too. Definitely the way to go. Obviously, transportation is a big area. Cost to cover all of the services is another one. One of the other things that would be very helpful to us, because we run a referral line, and anytime you put together information, usually about a week or two later, it's out of date. So keeping that information current is always one of our biggest obstacles. And what we have found is that counties that run regular coordinated service meetings, monthly, quarterly, or something like that, are the best, because we attend each one of those counties at least twice a year and talk to the agencies that are on the ground in those areas about what services are being provided, where there are funds available, where there aren't funds, which ones have dried up, and what the needs are in those communities, so that as changes occur, we can update our list. In areas where there aren't those kind of coordinated committees, either run out of a health department or some social service group, we have a much harder time keeping our list current and updated. We also have a little bit of a problem in some of our areas with either acknowledgement of the populations that are at risk or cooperation from agencies. We get groups that will say we don't have a homeless population, or we will get them to take them and pick them up in the police cars and take them down the next exit on the freeway and drop them off in the next town, neither of which help us in the least. So we do try to work with the law enforcement agencies and the various governments, but we're constantly up against the local sheriff that's been elected or the police chief that's been elected on those sorts of things. The final issue that we have is reporting and demographics, because we do work with a train the trainer model. A lot of these are small churches or smaller organizations that perhaps do one a month, and they're using volunteers to do this. And keeping their volunteers trained and available to do all of this is their primary concern. Data reporting is low or non-existent on their list.
Thank you. I will definitely be stealing your cookies idea. Thank you. So the barriers we have is people not having, the stigma associated with people being unhoused.
Yeah.
We know how people treat people who are unhoused in the St. Louis region. So what we do, we offer people clothes. They're able to take a shower. They're able to use our address as their address to receive their documents back. We also help them with the fee, and we do transportation. one thing we realized is having it on a certain day was not working with our population. 98% of the people we serve are unhoused, and it just life happens. They live outside. Sometimes they're not closed. So what we do is we're open 5 days a week, no appointments needed, and the service is available 5 days a week with no appointments. However, when we take people to the ID office or birth certificate office, we have a certain day and we shuttle. And one of us will go with them to be their advocate because, again, we know how they treat people. We also take all the paperwork with us during outreach. So at every location, we advertise for that, and people are able to fill out their paperwork, leave it with us, and then come back to the organization on a certain day to be able to go to the office, or we can shuttle them, and one of us will meet them there with the fee to pay for it. Uh, Another barrier we have is many organizations didn't know that we do this because we are a harm reduction center and we are a wound care clinic. So everybody just thought that was just our scope of service. So we've been working with partners or stakeholders, update them regularly on the services we have. We also, during outreach, we advertise in different areas, and that has been helpful.
Our barriers that we are currently facing now, this has been, well, first let me say, rural areas delivering cookies and cheesecake, that might work. But if you go down to the DMV or the highway, they're gonna say who made them cookies and we ain't eating them because we don't know. That don't work. So
Here, I know the difference.
that don't work for St. Louis City. So right. Don't try it, son. The most recent, well, a lot of issues, but most recently, we get offenders or clients straight from prison, and so they do not have ID. DOC has said that they would give IDs, and so depending on when they were ordered to transition out of the prison system determines whether or not they'll start that ID process. So 98% of the time they do not have ID, or if they ordered the ID, it never got to the client. And so for whatever reason, DOC knows that they're coming to wherever, because they have to approve those home plans. They will not mail those IDs to where the person is, the home plan. So we have to start the process over. The other issue we have is that DOC doesn't always verify their information. So you may get a client that has 3 different spellings of their names, 4 different social security numbers, and the incorrect date of birth. But if they don't come home with ID, then we have to use the paperwork that DOC has. That is often wrong. So then we have to go through and try to get all of the necessary paperwork, which, as Ms. Calvin had talked about, a letter of no record tends to be what we have to use. And oftentimes you will get people, it will take months for them to be able to get ID because you have to present a lot of information. And if their family members or mom, parents, whatever, whoever the record holder is has passed away, that is almost impossible to get. But on the other hand, fees don't stop because you don't have an ID. So people risk being reincarcerated. The other issue we have is the Department of Revenue for us, for my organization, has decided they will no longer honor the ID form that they required us to use. And so our letter of residency is no longer valid. So now we are trying to, so we have to mail them something to their apartment. So we have 92 scatter sites. So all the clients that come to us and our housing program, they are in their own apartment, but we have to wait till they get to us to mail them mail so that they have mail that says that this is their address to take to try to get birth certificates and social security, all that kind of stuff. It takes a while, and sometimes they don't get the mail. And then we also face trying to get out of state IDs, and that is, it takes a long time. California and Texas are the worst. But then we also work with immigrants, so trying to figure out if they, Mexican Americans or wherever they're from, they don't always know, and then we have to have a translator to come in and try to figure out, and then that is also a long process.
Thank you all so much for sharing. That was really very interesting, and you're all doing extremely vital work. So based on your work and what you're seeing and everything that you've shared, if you were to suggest 1 or 2 calls to action that the participants in the summit or the coalition could take in order to improve access to identification for the demographics that you're working with, what would that look like?
So one of the this is going to sound really simple, but it's one of the most important things we've started doing. We offer to keep copies of things. Having this HMIS system, it's a secure database we're able to upload. We help someone get an ID. We help somebody get a birth certificate. We offer to retain a copy of that. We have seen so many times now where that has helped when inevitably those documents get lost or they get stolen again, or we have to restart the process. So I think it's a very simple thing, but anybody who's doing this work and you're working with folks, if you can figure out a way to do that, something that is secure and you can help maintain records for folks, that is a very easy thing to do that makes a huge difference. Education, I think it got hit on very early on. We all know this is a huge problem. A lot of people don't know this is a problem. They don't know that even having access to ID, they don't recognize the barriers that are involved with that, especially for very vulnerable populations. And they don't realize the effect of not having ID. Similar to stories told this morning, we've seen people that was the one thing that was keeping them from getting into shelter, from getting employment, from getting housing, from getting benefits. And it is so frustrating to see. It is so absolutely frustrating to see, because like you mentioned, some really tough cases, and there's ones that are just absolutely, to untangle them, it takes so much time and effort, and everything just, life doesn't stop when you're trying to untangle those things. And so just the education piece, sharing and making people aware that this is a big deal. It's an important thing. It affects a lot of people. We typically, I do some data tracking, and I look every single month at the reasons why people are coming into our building and the services they're seeking and what it is that they're looking for and what services they're accessing. And some form of ID assistance is typically very easily every single month one of the top 3 or 4 reasons that people come into our center. And we have laundry, we have showers, we have housing assistance, we have affordable housing opportunities, we have prevention, we have diversion, we have all of these things. And every single month, some form of ID assistance is at the top of that list of why people are coming to see us. So it is absolutely vital to keep working in this realm.
We're going to do a Q&A.
At the end, yeah.
One of the innovative things that has happened in the Jefferson Franklin County corridor that we service is that the Jefferson County, I think it's called the Coalition for Coordination, JFCAC, and they have an NECAC in the northern areas. I think it's a regular Missouri County sort of thing. They got a grant and they put together a program called Easy Mo Rides. And it is sort of an Uber call center for people who need services. So they're able to go to the doctor, they're able to go get mental health, other kinds of services. They're able to go to the health department to get an ID or things like that. Unfortunately, it's not extensive enough to allow them to go grocery shopping or other things, and it does require 48 to 72 hours in advance, which is sometimes challenging. But in rural areas where we don't have services, putting grants together for these kinds of programs have been really essential. And if more of those could be spread into rural areas, they would be very helpful. The other thing that I think would be very helpful is, it seems to me that there are a number of healthcare and mental health care organizations that have deeper pockets than some of our small programs do. And yet they do not on a regular basis provide the costs for ID programs. They will call us up and we'll go into their organizations and do the IDs. I think that the healthcare organizations that are large in our area should have these as part of their regular budgets. And if you sit on their boards or you're an advisor to them, I would encourage all of you to talked to the bigger hospitals and the healthcare providers. I mean, the first thing they do when they see a patient in the emergency room is they put together a list of services that they need to apply for, but all of them require an ID, as you know. So if they don't have them before they can do any of those, they call me. And I don't think that that's necessary. They know how to do the paperwork. That's not the problem. They don't have the $15 in their budget. And I think that's a crime.
I'm changing my answer to that. That's exactly. So you have
Time. A lot of organizations have time, 2 hours windows and hour window for people to come. This is really a barrier for people who are unhoused. One of the reasons why our programs are successful is because we don't have appointments. People come when they're ready. It's 6 hours window for people. For wound care, for example, we have 2 days a week, 6 hours. You can come at any point and you get served. I think allowing and recognizing that people who live outside don't have the luxury of time that we have, and actually the education that keeping an appointment. So just start with radical generosity, and throughout the program, they will change. We also do keep copies of birth certificates and IDs. We have a safe box, and that has been helpful for people because people who live outside tend to lose their paperwork often. We also connected with other organizations. They come certain days in our building and provide services such as mental and behavioral health cares. They come and HIV testing and screening and education. So we don't have times, but we have days. So people know, our community know, I come, every Tuesday, so-and-so will be there. And that's how we start building trust. And that's how we're able to provide not just one service, but many services at the same place. Because as we know, people are traumatized from giving them numbers and, go to voicemail, nobody answered them. And they're just like, I don't want to call anymore. So one thing we have created is having people from other organizations physically come. They see a person, they talk to a human, they have a room, they talk about what they need, they get a service, they get an appointment right there and then. So we start the process even prior to them having an ID. And once their ID is in place, we send the organizations copies.
So I'll make mine quick. I do mimic everything that the panel has said. And so the other biggest thing for us is holding DOC accountable for making sure that every single individual leaving all of their facilities, as well as the federal facilities, have IDs. And so, just even their DOC ID is not an ID, because if they have a JPay card and they want to get money, they don't have, the PIN or whatever the case may be, they want to set up a bank account, the banks will not honor that DOC ID. They must have a state ID. And so making sure that DOC has verified their birthday, social security number, and have a valid birth certificate, valid social security card, and an ID when they leave. If they leave and they don't have it, let's just say Jeff City is backed up because at one point they had, 5,000 applications in a week. DOC knows where that client is leaving, where they're going to be residing. Send it there. FedEx, whatever the case may be, send it there, because we don't have time to wait for weeks and weeks for people to get IDs.
We're going to talk to you later because we want to work on that. And there's a bill I want you to talk to a senator about. All right, we're opening up for Q&As, and we already have our first Q. And I'm on the edge of my seat. This whole time I've been like, what's she going to ask? So
I just wondered if the HMIS system that you talked about, is it networked among agencies, or are they all standalone?
I'm going to try to not get very technical with this, but yes, maybe no, depends where you are in the state, what organization, what data sharing agreements. So within our continuum of care, we have an open system. So we are able to see different programs. We are able to see within the certain group within our state that is all on this same implementation and this same platform, they can see. So providers that have access in Joplin, they can see stuff that happens in Springfield. I see some St. Louis City, I see some St. Louis County, we see St. Joe. So there is some, and this gets into the HUD world when it comes to all of that, but there is some shared visibility. And for example, when we upload somebody's ID or birth certificate, if there is an HMIS housing provider, if, you know, St. Patrick's Center, they should have visibility into that and they should be able to see that as well.
Is that expensive for them?
There are different, so HUD says that all COC funded programs have to use HMIS, and then there's ways that it can be paid for either through COC funds or HMIS lead agencies write for funds. So it can get expensive, but again, it depends wildly on the HMIS lead agency and all sorts of things that are very specific to the COC housing world.
And can I add to that?
Yeah.
So also so we also use HMIS, but we don't use HMIS for identification. We use it for our rental assistance program. So depending, it's user friendly and user error as well. And so depending on how your organization uses it in conjunction with the COC is what information gets put in there. So Adam may see somebody from Criminal Justice Ministry in there receiving services, but it won't be for an ID.
Yeah, yeah.
Any other questions? I have 200 questions, so if no one has questions.
Just don't understand how having a copy of the ID in the system, a photocopy is just as good as no ID in most places, no?
No, we get places that'll.
Most places I've taken a photocopy ID, they're like, we aren't taking that, so.
I've never run into that issue. They will take a photo.
Yeah.
Really? Huh.
I heard someone back here say it works for HUD purposes, and you can use a photocopy of an ID to apply for a replacement birth certificate.
Yeah,
So
we
that's-
use it for birth certificates.
Get a new live one too.
but not to vote.
No, don't take the vote.
We have found though for replacements, it is helpful. And like if you could go to the DMV and show the old copy of the ID, then they have all the things. It's much quicker to pick up. Or we have clients who may have lapses in memory or things like that. And so if we already have a copy of a birth certificate, we have all that vital information. Or we can just, like their case manager can call and we can just reorder a birth certificate right away without having them have to come in and go through the whole process of giving us all that information again. So even in things like that, it could be useful.
You know, when we've talked about consistency at different places, I'll be honest too, sometimes it depends on if you talk to the right person at the Social Security office on the right day and they're in the right mood, whether they'll accept it, you know, and we've seen that with some banks and different institutions as well. So
also, crying works. We send our middle-aged white women to different offices and they start crying and all of a sudden they're just printing birth certificates. And it's send little old ladies to cry. It works every time.
when I try that, they just call security.
Yeah.
Yeah, okay, all right.
So I just wanted to ask Jolene if you could repeat what was your recommendation that was seconded there?
Getting behavioral.
Your call to action.
My call to action is that I'm actually going to call names out here. We work with Mercy Hospital on a regular basis. They do all the emergency intake for our homeless populations and all of our at-risk in the area. We use Compass Health and a lot of the other agencies like that. All of them require IDs in order to refer their clients for services. And basically what they need, they're putting together food stamps, they're putting together Medicare programs and things so that they can actually access all the hospital or healthcare or mental health care services. And they know how to fill out the forms for an ID. I've trained them all, but none of them put into their budgets to do that. I'm a very small little nonprofit that is largely underwritten by this program here. And our money gets transferred across 15 counties. And so to go in and underwrite
people who are at large hospitals and healthcare systems doesn't seem practical to me.
It's not the best use of our funds.
All right, my question is for Stephanie, because you kind of mentioned when persons are being released from DOC, that they're having issues with getting their identification. And my concern in that other paperwork, birth certificates, but I thought they started that process 6 months prior to them being released, and they're still running into
Sure.
issues. So kind of
Sure, they started
unwrap that for me.
It's unwrapped. They say they started. Yeah.
Yeah.
Yeah, hard
That's
to
it.
stop, that's it.
Drop by, yeah.
They have, they make excuses as to why when the process was supposed to be started, that it didn't get started. So as he stated,
Get his name. What's your name again? I forget.
Greg, thank you. I'm so sorry, Greg. As Greg said before, you know, the higher ups in DOC said, you know, every single facility has an ID machine, which was not true. And then most of the ones that do have them, they don't work. So they just don't get an ID. And depending on, you know, the turnover, who is responsible for that person, whether or not the person gets to see the IPO during a certain period of time, or the reentry supervisor. So now every facility has a reentry department supervisor, whether or not they get to see that person and the reentry process is started. That's a barrier. But then they also want to start working with them 6 to 9 months. Well, what about those that have a shorter sentence than 6 to 9 months? They don't go. So
I don't know to whom this question would be best asked, but is it possible that DOC couldn't contract an individual specifically for that role? So that way, essentially, we don't have a conflict of interest for a system that doesn't care about the lives of the individuals that they're supposed to be stewarding.
are you asking DOC to spend additional funding? I'm just.
I recant my question.
Oh, okay.
Just kind of to play on to what she said, though, I mean, can we set up a volunteer situation in, you know, in certain incarcerated, you know, situations or whatever, so that we can help, like that we go in. It is not costly to them, that we can enter and help that situation so that when they do leave, they do have access. I mean, that's, when I work the clinic, it makes me crazy when people come out of incarceration. It's absolutely clear that they have an identity because they've been incarcerated. For them to leave jail at any level and not have an identification is just, it's just unacceptable. I just don't understand it.
We've had the best, we agree. I think all of us have dealt with prison release in one way or another. And the best case scenario sometimes is they get a piece of paper with a copy of their booking on it and stuff, which is always really good to show somebody. It really projects a really good image. But the best luck we've had have actually been with programs like these ladies or other reentry programs, because they're really focused on trying to get an ID for them right away. And whether their programs provide IDs or they call programs like ours to come in and provide those IDs, having a coordinated group that's helping them on the outside seems to have been the best results we've seen anywhere. And it's exactly the kind of programs these ladies are running.
If you guys want a free policy advocacy idea, one of the, that's why you're my favorite. One of the remarkable things about Department of Corrections is that even Department of Corrections photo IDs usually aren't accepted in other government agencies, which is wild because it's a government photo ID. So there's a real effort at different places. The New York municipal ID, which is good for 10% off at the Symphony, but they don't accept a DOC ID. as a photo ID. So we've been working with some council members on that, but that's a really good policy thing because it is a government issued photo ID. And if people getting released could just take that and, you know, some other documents or birth certificate, whatever, to the DMV, that would solve a lot of these problems, but it's not actually on a list of acceptable documents. So free policy idea that we will work on with you.
I'm not familiar with the number of prisons that are private prisons, but what I'm thinking of, isn't that in their interest to not give someone who's been incarcerated documentation so that they will be coming back in and they can continue to make
Absolutely.
the-
Absolutely.
So how does that get, how can we address that?
Yeah. Well, here so this is a question like this, like the county clerk thing, right? Where it's who lobbies better, because it's better for the private prisons, but it's worse for the state. So it's about going to legislators and saying, I know you're hearing from these private prisons because they really want this slave labor and all the money they're getting from you, but this is how much it's costing the state versus how much the state would make, because lawmakers on both sides of the aisle really want to reduce recidivism because it's really, really expensive. And so this is where you go and say, here's the cost differential, and the ROI for the state is actually a lot higher to make sure that these people have IDs and are getting jobs and become taxpayers, which is all we want is for everybody to pay tax. If babies could pay taxes, it would be. And you just out lobby the private prisons.
My question is, hello, thank you, hi. My question is, if there is something that you would like to see, let me rephrase this. Can you offer a way that this coalition could be most helpful to your work in terms of either the barriers you're seeing or where you're pissed off the most or where you really just need extra help or like, you know, church ladies to make some cookies or something in outstate Missouri. What is there, do you offer anything that the coalition could do that would be more helpful to your efforts generally?
I think how the coalition can talk to the other side, right? The people who provide these documents. It seems like they are the biggest barrier, right? Because they require so much. Like you said, the King's Highway, oh yeah, that office is, yes. True. So how can we just meet with them, talk to them, advocate on behalf of the participant or the community that we serve? Because really, they are traumatizing people every day.
Steph, you said Department of Revenue was giving you guys a hard time with the
form that they
forms.
require. Yeah.
So every now and again, I'll get a call from our local office that says, DOR sent us a thing and we're in trouble and we need to do X, Y, Z. And then we have like a backup of all of our communication and everything with them previously to be able to at least show like, hey, look, no, this is good. It's something you said was okay. And so we're able to keep going. But it terrifies me when that happens because I know, like, I have this fear that at some point, somebody somewhere in Jeff City is going to decide that we can't do what we're doing anymore. So anything I think where we're engaging at that level and trying to get anything codified and just formally, you know, so that there's no such thing as forever, you know, because anything can change. But I just want to be able to sleep at night. So can we do that? Can we just make sure that, like, you know, I think that would be a great way to be involved in just working with Department of Revenue on that and to clear up because they need to take Stephanie's letters.
I have a question maybe on that note of just the inconsistency across license offices. I know that's something that many of our coalition partners have experienced. I know plenty of the College Church volunteers in this room have tried to call around to license offices about the free ID to vote and other issues just to figure out what's actually happening. And it seems like often you have to go in person to really understand what's happening on the ground. And so there's two sides of that. There's the bad experiences, and then there's also the like, maybe this clerk at this office is a little more lenient, and the things that we don't want to say too loudly because we don't want them to go away, or maybe there are exceptions that aren't supposed to really be happening. And I guess my question is, how have you all navigated like finding out which license offices work best for your folks and how to like spread the word about that? And do you have any recommendations for us as a group that is like publicly doing stuff, but maybe also can have an internal communication system to kind of figure out how to share best practices with license offices or how to best seek consistency across offices, which is maybe a lot of questions in one, but anything you have in response to that.
In our area, we have a lot of choices about Department of Revenue offices. We don't get a lot of health departments or social security offices, but usually there are a lot of DMV offices. And we have good and bad list. It's sort of like a naughty and nice list for Santa. And we are very blunt about where clients are to go and where they're not to go. Because we have a couple of ladies who work in one of our offices who are tyrants. And I went in there with a military ID and she would not give me an ID. Thinking that my military ID was not acceptable because retired military get an indefinite date on them. And so mine doesn't have an expiration date. And so she would not take a federal military ID with my photo on it as a secure form of ID. But we have another lady who is just a sweetheart who we bake cookies for on a regular basis. And she takes letters from every agency in the county. She will take blood samples, whatever we've got. She bends over backwards to make sure that she takes care of anybody we send in there. We also have another office who has called me up on the phone and said, I've got a homeless gentleman in here. I think he's who he says he is, but I don't have any payment for him. Could you give me your credit card over the phone? And we say yes.
Wow.
Yeah, it's,
So there's a big gamut.
yeah, ours was trial and error and just figuring out, and
Do you guys see any individuals that are physically unable to go to the DMV? And if so, what are your solutions to get them an ID?
I can do that one again. We definitely have individuals who are incapable of doing it. In our area, they fall into two categories. One is they're in extreme health situations where they're usually hooked up to machinery that is difficult to transport them. The other case is where they're obese and have difficulty transporting them because of their size. In both those cases, we try to get extra funds together because the passport office of the federal government will take a photo ID that you mail in as long as it's the right size and has your picture clearly in it. Now, they're expensive, but it does give you an alternative.
Yeah,
You can use that to vote.
Yeah, you absolutely.
A passport and a military ID, both are acceptable federal government documents to vote.
Yeah.
Although Franklin County doesn't take military IDs.
And we can learn more about what you need to vote from Denise later today.
We also have that issue, but most of the time it's because they are handicapped in some form or fashion, in wheelchairs. So we do provide bus tickets and bus passes so they can get there. And most of the time they come with a referral, so their case managers will come and then they can also validate and verify who that person is to get them down there to get their ID.
And I would be remiss not to mention at this moment that we're calling it homebound ID option, and an option to apply for an ID for people who cannot physically make it to license offices is something that the coalition will be prioritizing in the coming months and years. And if you look at page 18 of your program, you can see a little more about that. I mentioned this in the business meeting portion earlier, but I do want to introduce my co-chair of the Government Relations Committee, Vincent Heitholt, who's been able to arrive since then. He has been one of the strongest advocates for this work. So if you do know someone who's impacted by this, or if you want to get involved, I'm going to send people to you, Vincent. Or there's info in the program. And Liam has something to add.
So earlier you mentioned municipal IDs, and Kansas City, Missouri has a municipal ID. St. Louis, we're writing the bill for it now. So my question for the panel would be, for the people you work with, what would be a helpful thing if there was a St. Louis City County ID issued? What would be things that you would want that to include.
And if it's helpful to have a little more context on what a municipal ID is, maybe would you be willing to share just a little bit?
So it would be a government photo issued ID by the city and county of St. Louis. And it's helpful in a few different capacities in different cities that have done it. So sometimes it helps like trans folks so that they can, for instance, in Missouri now, you can't identify gender marker change in Missouri on your Missouri ID. So it'd help with that, give an X option. Or for people who are immigrants that it's really difficult to get state issued ID, it would help immigrants be able to get one and have a photo picture government ID. But also it would help maybe people who are formerly incarcerated get IDs quicker, and it can help get a state ID later because again, it's a government photo issued ID.
Yes, all of that. Yeah.
And a discount on symphony tickets.
And-
So I'm thinking about some of the things we've been able to do locally with that ID that we're able to generate out of the HMIS system is we've got our libraries will accept that as an ID for folks wanting to sign up for library cards to be able to access the library system. Our emergency shelters that previously required state ID to even be able to walk through the door are willing to accept that ID in lieu of that while they work on getting state ID. We've got a couple of banking institutions that will accept that ID in order to help people get accounts set up. So I think anyone you can convince to take something like that, that would be willing and able to accept a municipal ID in lieu of state would be beneficial.
I just want to say, I understand the issue of getting the municipal and the city IDs, but I want us to focus on what's required by the state, 1878. Either get that changed or include that state issued photo ID for everyone, because that's what's required for voting. If we can get to that, that's what we need to think about.
Is there any action people can be taking related to municipal ID right now? Or not yet? Not until the election's over, but keep an eye out. There may be more action on municipal ID if you're in the St. Louis area.
Oh, food pantries, that's another one.
Yeah.
Get them to-
Yeah, food stamps.
Yeah. What about treatment facilities?
I think so.
I would say one of the things that we've learned in other cities is clarity, because a lot of times immunity ID passes and then people don't actually know if they can accept it. And so like some banks do and some don't. Some housing places do and some don't. Some DMVs do and some don't. So having real clarity on who actually can accept this, which of course going, sort of by what we're doing in Congress, have no clarity in the bill so that there's no one they're specifically saying no to, and then go to all of these agencies and say, hey, you can take this because they didn't say no, is kind of the best way. But making sure the treatment facilities and the food pantries and the DMVs and whatever know, hey, there's this new immunity ID coming out. This is what it looks like. You can't accept it. You can accept this. Makes a big difference, because that's been a big problem with new immunity IDs, is everyone's just really confused. More questions? We have so much time. We could write a bill right here. Okay, well, in that case, we're gonna give our panelists, if there's anything you wanna say to sort of wrap up call to actions, please give your contact info, websites, whatever, so folks know how to reach you.
My contact info is Stephanie, first name STEF as in Frank, ANIE, M as in Mary, at cjmstlewis.org. I'd really love for all of our clients to have IDs as well as those that we serve that are unhoused. But I'd also love for being incarcerated on supervision not to be a barrier to vote. So that is another issue that we are dealing with down the line. Yes, Stephanie, S-T-E, F as in Frank, A-N-I-E, M as in Mary, at cjmstlewis.org. I also put, we put flyers and cards out on the table up front. So it has our general office and location number, and my extension is 111 if you call the main line.
We'll also make sure that when we send follow-up email, that you have speaker contact information in the email itself.
So Sandra, my email is sandram@thetstl.com. And my phone number is 314-797-2831. And usually I respond within 24 hours. So.
Hi, our program is the Vital ID program of East Central Missouri. And the email is vital, VITAL, .id.ecm@gmail.com. Our phone number is 314-301-9846. And I answer 24/7 as long as I'm getting reception on the tractor.
All right, we've come full circle. We started by talking about how obnoxious my last name is to pronounce and spell. I'm not going to try to give you my email address. Come see me, come talk to me after this if you would like it. I will write it down for you. And I think like everything is getting mailed out. So if you want to know more about in general the work we do, cpozarks.org, and you can actually find me on that website too and reach me that way. So.
Well, thank you. You guys were an amazing panel. You're doing incredible work. We now have a list of ideas of how we want to work with all of you.
And thank you everyone for great questions. And now you have a little bit of extra time to go get more snacks.
Thank you, panel and facilitators.